Okay, yeah, and you said Myopia Control Coordinator, which I absolutely love. Can you go more into that
Yeah.
so that people can get an idea of that part of your whole office experience and your staff?
Yeah. Well, I realized early on, or maybe not early on, as soon as we started to get busier with it, right? And I've been fortunate enough to be in a good area for myopia control. It's fairly affluent. It's intelligent parents that understand the conversation, that do their own research, which their own research helps. It doesn't hurt. It helps.
Hmm.
And then we also have a high Asian population, and there's just a greater awareness in the Asian community. It's been forefront in China, for example, a lot longer than it has here in the U.S. So I get questions about it before I've even had a chance to bring it up in those cases. And as we got busier, what I realized is this is new for so many patients and so many parents. The volume of questions they have compared to our standard, just come in for your annual eye exam. They have a lot of questions and they need some hand holding is the best word I could give for it. They need a reassurance here and there. They need a cheerleader here and there. They need some questions answered. And if we leave it up to just whoever happens to answer the phone, it's really difficult to have the level of training across every staff member to answer those questions the way I want them answered. But if we have a coordinator, I can kind of put together a frequently asked questions list for their reference, and I can have a meeting with them here and there. And it's the same person bringing me a question. If they get a question they don't know the answer to, it's not everyone in the office. It's the same person bringing me that question. So they learn the answer to that question, right? And then gradually over time, they can answer most of them. And I'll tell the parents that. I said, this is Sarah. Here's her business card. I introduce her. I say, if you have questions, if you have concerns, call, ask for Sarah. And chances are she knows the answer. And if you manage to stump her, then she'll bring it to me. Congrats if you manage to stump her. She's been doing it for a little while and she's not stumped that often. And so, yeah, it just lets me have a go-to. It's one person to track the orders for the lenses that we make. Make sure we receive them when we're supposed to. Make sure that they get dispensed to the child and they're scheduled for their follow-up if they need one. And somebody loses one, to take the phone call and coordinate the order for a replacement and keep that separate from just the regular soft contact lenses. And I have a different technician that does that.
I love it. I love it because we often talk about the importance of having your staff be an important part of the process. And your whole structure is only as strong as the one person who, the patient's parents were like, oh, by the way, you've already seen them, you're on to the next person. And they say,
Sure.
oh, I have this question. And it's like you need your staff to be able to pick up and, answer those questions and work with them and be
Yeah.
knowledgeable on it. So I love the idea of having a dedicated coordinator, a dedicated person who can be that extra step in the process and help the patients learn more and feel more comfortable about it. So thank you so
Yeah.
much for bringing that up.
And there's a lot of good resources for that too. So this is the second coordinator I've had. The first one I had retired, but
Okay.
I had brought her to Vision by Design, the boot camp for staff,
Hmm.
and she had gotten a bunch out of that. And then the plan was to do the same with this one this year. We didn't plan on coronavirus, but we'll have another
Right.
one in some format in the future, right? But
Hmm.
there's resources out there. And then as a doctor, what the top 20 questions, if you sit down and think about it, that you get from patients. So, it's easy to put together a starting point for them. And then over time, they kind of build a little reference folder for themselves. I'm surprised, pleasantly surprised at times when I hear her explain something that I really thought I would have to be the one explaining and doing a really nice job with it. And it also doesn't hurt that I fit her in Ortho K. So she's gone through the process. Now,
Yeah, exactly.
she's a low correction and she doesn't wear it every night, but she's gone through the process and knows how it works. She knows how they
Hmm.
feel. And it adds that personal element, which you can say, oh, yeah, well, when I do it, I always make sure I put the right one in first. And then I go to
Right.
things like that. It resonates. It's kind of like
Right.
just a buddy telling you how they do it, except she's a more official title for it.
That's such a great point because like if I'm ever out pre-pandemic, of course, at a bar or a party or whatever the case may be, and I talk to somebody about Ortho K, one of the first questions I get is, "Do you do it?"
Mm-hmm.
And when I first started working for the academy, back when we were the Orthokeratology Academy of America, one of the things I said to Carrie is I said, I want to see what this is about. My correction is very minimal. I don't need Ortho K lenses, but I was like, let's get some lenses, let's put them in the eye. I want to sleep in them. I want to see what this is all about, because how am I supposed to work to represent and help eye doctors learn how to do this if I don't know anything about it? And so it's paid off in spades when I talk to somebody in a social situation and they say, well, do you do it? And I said, well, I used to do it. I don't need the lenses, but I wanted to see what it was all about. And then they can say, well, how does it feel on your eyes? And I can give them an example. Or, what was it like to sleep in it? And I was like, it's surprisingly comfortable. Like, you just need to get used to the idea that you have something on your eye. And then when you close your lids and go to sleep, it's actually not an issue, and you get used to it really fast. And there's just that, I don't know, I don't want to call it like mistrust, but it's more reassuring when you are talking to somebody who's actually done it or knows what they're talking about. So I
Sure.
absolutely love that.